Mr. Speaker, I move to suspend the rules and pass H.R. 3527, the Poison Center Network Act, as amended.
The clerk will report the title of the bill.
H.R. 3527, a bill to amend the Public Health Service Act to reauthorize the Poison Center National Toll-Free Number, National Media Campaign and Grant Program, and for other purposes.
Pursuant to the rule, the gentleman from Pennsylvania, Mr. Pitts, and the gentleman from New York, Mr. Engel, will each control 20 minutes. The chair recognizes the gentleman from Pennsylvania.
Thank you, Mr. Speaker. I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert extraneous materials in the record on the bill.
Without objection, so ordered.
Mr. Speaker, I yield myself such time as I may consume.
The gentleman is recognized for as much time as he wishes to consume.
Mr. Speaker, H.R. 3527, the Poison Center Network Act, introduced by Representative Lee Terry, reauthorizes important activities related to poison control centers. Specifically, the bill reauthorizes the National Poison Center toll-free number, the Poison Center's national media campaign, and the state grant program, which funds 56 poison control centers around the United States. The Department of Health and Human Services estimates that in any given year, there will be between 3 to 5 million poison exposures. 60% of these exposures will involve children under the age of 6 who are exposed to toxins in their home. Poisoning is the second most common form of unintentional death in the United States and accounts for 285,000 hospitalizations a year. According to a report from the Institute of Medicine, every dollar spent on poison control center services saves $7 in medical spending. I would urge all my colleagues to support this bipartisan bill, and I reserve the balance of my time.
The gentleman reserves his time. Gentleman from New York.
Thank you, Mr. Speaker. I rise in strong support of H.R. 3527, the Poison Center Network Act, and I yield myself as much time as I may consume.
The gentleman from New York is recognized for as much time as he wishes to use.
Thank you, Mr. Speaker. Before I begin, I would like unanimous consent to put into the record the gentleman from New Jersey, Mr. Pallone's floor statement on this bill.
The gentleman's statement will be covered by general leave. The gentleman is recognized.
Thank you, Mr. Speaker. This important legislation, which passed the Energy and Commerce Committee by unanimous consent in December, reauthorizes the national toll-free phone number, media campaign, and grant program, which have helped make poison centers an incredibly successful program. First passed in 2000, National Poison Center legislation was championed by our current Energy and Commerce Committee Chairman, Mr. Upton, and our former colleague, Ed Towns. Since then, the National Poison Center legislation has been reauthorized twice, and I'm proud to say it remains a very bipartisan product. Chairman Terry, thank you for your leadership on this issue over the years and your hard work on this reauthorization. This is a good bipartisan bill, and I'm pleased to have had the opportunity to work on it with you. Poison exposure is a leading cause of unintentional injuries in the United States, and it was the second leading cause of unintentional injury deaths in 2010. According to a recent Lewin Group report, poisoning is accounted for over 2.1 million emergency room visits and 438,000 hospitalizations in the year 2009 alone. I think most of us with children remember either having a magnet on our refrigerator or a sticker on our phone providing the contact information for the poison center in our area. The experts that staff our nation's network of 57 poison centers are available 24 hours a day, 7 days a week, 365 days a year. In 2012, poison centers handled an average of 9,200 cases per day for a total of almost 3.4 million cases over the course of the year. Over 90% of calls into poison centers were due to a poison exposure in someone's home, and approximately half of all cases involved children under the age of 6 who were exposed to toxins in their home. In my home state of New York, we have 2 poison centers. Between the 2 of them, they field over 164,000 calls per year. The New York City Poison Center found that 88% of all exposures to a dangerous substance occurred within someone's own residence. Many of these calls were related to the accidental ingestion of various cleaning products or detergents, but in 2012, the New York City Poison Center also fielded over 2,000 calls regarding prescription painkillers. For the upstate New York Poison Center in 2012, 85% of calls were related to unintentional poisonings, 62% involved children under the age of 5, and most importantly, 82% of cases could be managed over the phone, and it did not require a visit to a doctor or a hospital if hospitalization is necessary. In 2011, poison centers helped avoid an estimated 1.7 million unnecessary healthcare visits and have been shown to decrease the amount of time an individual spends in the hospital. While a visit to the emergency room can cost hundreds of dollars and a hospitalization can cost thousands, a phone call to a poison center only costs around $30, which shows poison centers continue to be a smart public health investment. I think it is also important to note that poison centers are an incredibly valuable resource to healthcare providers. Poison centers provide access to board-certified medical toxicologists, which can assist with the triage, diagnosis, and treatment of patients with known or suspected poisoning. Poison centers are a true partnership between federal, state, and local governments, as well as in the private sector. In 2011, poison centers obtained only 13% of their funding from federal grants, while 62% came from state and local governments and 25% from private funders like hospitals and insurers. Adequate funding from all sources is important in order to continue to provide high-quality experts and services in the name of poison prevention for our constituents. Mr. Speaker, by all accounts, poison centers have been an incredible success and a program that we should all be proud to be part of. In addition to my gratitude towards Mr. Terry, I would also again like to thank Chairman Upton for his leadership on this issue, as well as Ranking Member Waxman, Chairman Pitts, and Ranking Member Pallone for their assistance in bringing this bill first before the Energy and Commerce Committee and to the floor today. And as the lead Democrat on this bipartisan legislation, I urge my colleagues to support this legislation, and I reserve the balance of my time.
The gentleman from New York reserves his time. The gentleman from Pennsylvania.
Mr. Speaker, at this time I'm pleased to yield 2 minutes to the gentleman from Michigan, the distinguished chairman of the Energy and Commerce Committee, Mr. Upton.
The gentleman from Michigan is recognized for 2 minutes.
Well, thank you, Mr. Speaker, and I want to thank my friends, Mr. Engel, the lead Democratic co-sponsor of this bipartisan legislation, as well as Mr. Terry, who has helped champion this not only in this Congress, but for the last number of years as well. This bill needs to get done. H.R. 3527 is really good legislation, and it's bipartisan. It funds more than 50 poison control centers across the country, and in 2012, more than almost 4 million calls were managed by our nation's poison control centers. These centers and the physicians, the nurses, the pharmacists, and toxicology specialists who staff them save lives by providing free and confidential health services regarding potential exposure to harmful toxin 24/7 and in 150 different languages. So let me tell you about Michigan. The Michigan Regional Poison Control Center at DMC Children's Hospital in Detroit is one of the largest and busiest poison centers in the country, offering leadership in new data collection processes and identification of new trends in poisoning. The center provides assessment, triage, management, continued monitoring of more than 90,000 poison exposures in Michigan every year at no direct cost to the patient, the practitioner, or the healthcare institution. Poison centers like this save money, as many of these crisis calls avert an expensive trip to the emergency room. In fact, in a 2012 report by the independent Lewin Group determined that the nation's poison centers save more than $1.19 billion in avoided medical utilization and reduced hospital lengths of stay every year. In addition, every $1 of funding saves about $13 in unnecessary health care costs and lost productivity in the country. Our nation's poison centers exemplify successful public-private partnerships. If I could have another 30 seconds.
Yield the gentleman an additional 30 seconds.
Gentleman is recognized for 30 seconds.
Thank you again. Our nation's poison centers exemplify successful public-private partnerships, with federal funds providing only 18% of the poison center budget. That partnership saves the federal government a lot of money, while also delivering access to critical services for Americans across the country, let alone the lives that we save. So I would ask every one of my colleagues to support this very important bipartisan legislation. And again, I want to commend the leadership of Mr. Terry and Mr. Engel for their continued effort on this to get her done. I yield back the rest of my time.
The gentleman from Michigan yields back. The gentleman from Pennsylvania reserves. The gentleman from New York
Yeah, I reserve.
reserves. The gentleman from Ohio or Pennsylvania.
Speaker, at this time, I yield as much time as he may consume to the prime sponsor of the bill, gentleman from Nebraska, Mr. Terry.
The gentleman from Nebraska is recognized for as much time as he wishes to use.
Thank you, Mr. Chairman, Mr. Speaker, and I thank the chairman for recognizing me, and I thank the gentleman from New York, my good friend, who we worked on several bills together, but the poison control bill is certainly one of those that we've been active on for several years now, and thank you for your involvement and your staff's involvement. They've done a great job. Mr. Speaker, this is a bipartisan and a bicameral bill. Not only were we in negotiations and just working together in a bipartisan way in the House, but our team in the House, Elliot Engel and myself, have been working with the Senate, and they have an identical bill to this. And this bill reauthorizes the National Poison Control Center's toll-free number, the Poison Center's nationwide media campaign, and the grant program, which provides funds for over 50 poison centers nationwide, including the one in Omaha, Nebraska, that I recently visited. Currently, 56 poison centers serve all 50 states and 24 and its territories, 24 hours a day, 7 days a week. Yes, even Christmas. These centers provide professional advice from doctors, nurses, pharmacists, and toxicology specialists to people calling in with questions or concerns regarding potential exposure to harmful toxins. Nebraska's Poison Control Center has a direct relationship with our medical center, and you'll find that very common in many communities and states. In 2010 alone, the annual report of the Poison Control Centers reported over 3 million calls received and served by the centers. In 2012, more than 3.9 million calls were managed by our nation poison control centers. Our National Poison Center network also serves as an ideal example of public-private partnership that saves the federal government money, billions of dollars each year in avoided emergency room expenses, while delivering access to critical services. 80% of the Poison Center's operating budget comes from non-federal sources. In 2012, an independent analysis found a large portion of the savings provided by Poison Centers saved S-CHIP, Medicare, and Medicaid funds more than $700 million a year just for those programs. America's utilization of the nation's Poison Control Center information and case triage services results in avoiding more than 1.7 million unnecessary visits to healthcare facilities. Now, I encourage every member of Congress to visit their state's Poison Control Center, where they'll see great professionals work with frightened people on the other side of that call in a remarkable way. And I also encourage them to support this bill and yield back my time.
The gentleman from Nebraska yields back. The gentleman from Pennsylvania reserves. And the gentleman from New York is recognized.
Yeah, I have no further speakers, Mr. Speaker, so I yield back the balance of my time.
The gentleman from New York yields back his time. The gentleman from Pennsylvania.
Mr. Speaker, we have no other speakers. I would urge all members to support this bill, H.R. 3527, in order to save lives. It's a bipartisan, good bill that deserves every member's support. And with that, I yield back.
The gentleman yields back his time. The question is, will the House suspend the rules and pass the bill H.R. 3527 as amended? Those in favor say aye. Those opposed, no. The opinion of the chair, 2/3 being in the affirmative. Gentleman from Pennsylvania.
Request the yeas and nays.
The yeas and nays are requested. All those in favor of taking this vote by the yeas and nays will rise and remain standing until counted. A sufficient number having risen, the yeas and nays are ordered. Pursuant to Clause 8 of Rule 20, further proceedings on this motion will be postponed.
H.R. 3527, a bill to amend the Public Health Service Act to reauthorize the Poison Center National Toll-Free Number, National Media Campaign, and Grant Program, and for other purposes.
Question is, will the House suspend the rules and pass the bill as amended? Members will record their vote by electronic device. This is a 5-minute vote. This vote, the yeas are 388, the nays are 18, 2/3 being in the affirmative. The rules are suspended. The bill is passed, and without objection, the motion to reconsider is laid on the table.